Hello, everyone. Thank you for joining us today. My name is Stephanie Anderson, and I am the Industry Operations Manager for the National Apartment Association. In a continued effort to provide our membership with timely and relevant information and operational guidance amid COVID-19, also known as coronavirus, we are producing daily updates in the form of micro webinars. Each day, we will focus on a different topic relevant to the apartment industry. At this time, I would like to direct your attention to the screen. Please take a moment to review our disclaimer. Today, I am thrilled to introduce Todd Usher, Manager of Public Relations at the National Apartment Association. Todd will be sharing guidance on how to handle media relations during this national pandemic. Todd, welcome.
Thank you. Thanks for having me. I'm happy to be here today. Today, we're going to talk about how to deal with the media in this coronavirus environment. So coronavirus is definitely a crisis, and you should always have a plan for a crisis. But since this is an unprecedented event, I will walk you through the process that we use here at NAA in crisis communication situations and give you some best practices. Let's begin by defining crisis communications. It is a subspecialty of the public relations profession that is designed to protect and defend an individual company or organization facing a public challenge to its reputation. Effective crisis management has the potential to greatly reduce the amount of damage the organization's reputation receives as a result of the crisis. So first off, you need to prepare. If you have someone that has tested positive at your community, you need to make sure that you have key people involved, including your owner, your corporate team, your communications team, an operations expert, and a legal expert. Excuse me. You should have people from across the organization who bring all different expertise and viewpoints to the table. And ideally, you would have had these folks identified before a crisis hits and begun preparing them. If you don't have your team identified yet, I would strongly recommend you put it together as soon as you can. So NAA has a crisis worksheet that you can fill out, and it's linked on our website. And I believe it's on the coronavirus resources page as well. You can utilize this to track decision making and get a better handle of the situation. We've laid it out so that you can answer the questions in a logical manner and utilize your crisis team to fill it out. The problem in most cases will be there is a positive test in your community or one of your employees has tested positive and may have exposed other employees and residents. The urgency is that you need to communicate with your residents, your employees, and your owner, your corporate team, and any investors. And you need to do so quickly before residents get wind of a positive test, because they won't call you, they will call the media and say you aren't doing enough to protect them. The best case scenario is that you've taken care of the problem and no one calls. But what happens if someone calls the media or if the media calls you? You need to know what your options are, what your desired outcome is, and you need to come up with that and fill in the worksheet. What's the best way to tell people what you want to tell them on what you want them to know? Do you take an interview with the media? Do you issue a statement, or do you not say anything? I do want to distinguish saying nothing versus saying no comment. No comment has a negative connotation. People will think you're trying to hide something if you say no comment. So if you decide not to say anything, just don't respond to the media inquiries. Once you've decided what your best solution is, you need to have reasons that justify it and that then you can put that solution into practice. Before you do anything involving the media, you need to make sure you know who is going to talk to them. And it should be somebody that can handle the scrutiny and won't crack under pressure. Ideally, they have had experience working with reporters before, and this is where your comms team can be particularly helpful. Fortunately, in this era of quarantine, you can submit answers to written questions as well, which can make it even easier to control your message. Your comms team can draft the message and send it to under the spokesperson's name, But if a TV outlet would like a Skype interview or something similar, then you need to be prepared. Make sure that they are ready. Practice by asking tough questions and seeing what their response is. Pay attention to nonverbal communication. They should not have their hands in their pockets or behind their back. They should be leaning toward the webcam slightly to project an open posture. Their hands should be visible. That way it looks like they have nothing to hide. For a video interview, you're going to want to wear solid colors, but not blue or green, because that's what they use to superimpose backgrounds generally. And you can always buy yourself time to develop messaging when you need to. You should have a holding statement ready to go. So if somebody calls, you can say, we're aware of the situation and currently investigating. This will give you that extra time to develop your key messages. What do you want the public and the media to know? And you can draft a statement at that point. When developing your messaging, you have to be mindful of what you say. Don't say anything you don't want to appear in print. And what are you going to say? Is there a positive case? What precautions have been taken? What steps are currently in place to protect the residents? It's going to draw more attention to your community. You also need to communicate with your stakeholders. You need to make sure that staff and residents are in the loop so that you can calm their fears and assure them that steps have been taken to protect them. And more importantly, you can quickly kill rumors and speculation, which can muddle your message. So it's happened, you're prepared, and a reporter calls so that they want to know what's going on. There's a positive test or a potential exposure at your community. Your staff should know who those calls are directed to. Make sure that they know they go to one person. So for example, here at NAA, the staff know that any media calls go to me. They don't go to anyone else, and they don't answer media questions at all. When they call, it's fair. Ask what their deadline is. Ask if you can submit written answers. You can ask what the questions are, and from there you can choose your method, whether you do a statement or an interview. If they're insistent on an interview, make sure your spokesperson is available and knows your messaging and talking points, and that you've fully prepared them. And be candid, be truthful, transparent, responsive, human, and empathetic. And if you make a mistake, don't worry about it. You can clarify and correct. The media are generally under a huge time crunch anyway, and they're short staffed. So they're human. They understand that mistakes happen. And if you're human and you're empathetic, then they're going to cut you a break. So you don't really need to worry about that. So you've done everything. The interview went well. After it ends, make sure you ask when the publication date is or when they're going to air it, and monitor the outlet for coverage. So that's the basic way to deal with the media. Now, NAA has some resources available to help you. You can always contact your local affiliate. If they don't have an answer, then they can connect with the PR staff here at NAA. So that would be myself or Frank Mock. We do have guidance for crisis communications as well as the crisis worksheet on our website. I think most affiliates have that toolkit as well. And if all else fails, you can always reach out to me directly. My contact information is on the NAA staff page. So thanks for letting me share how to deal with the media for you.
Todd, thank you so much for that informative guidance. We really appreciate it, and I know our members will find great value in it. For more information on this topic and others related to COVID-19, we do invite you to view our coronavirus resources and guidance page at naahq.org, where new resources and information are being updated daily. Thank you for joining us again, and we look forward to another great micro webinar tomorrow. Have a great day.